This is Pillow Talk. Pillow Talk. Pillow Talk.
This is Pillow Talk with Marion the man.
Fabuloso.
You said it has to do. It has to do with who? Doctor. Okay, the Dr Okoawo.
Yes,
Okay.
Dr. Okoawo.
Okay. What about it?
Yes. Yes, I'm quite familiar with the case. And the case, in all objectivity, is not as the way it was put in the net. I'm not holding brief for him, but I just think it's a bit damaging. The case is not the way it was actually presented on the net. I am very familiar with the case, and I have spoken with patients on this before she got it across to you.
Okay.
That's why I'm calling you.
First of all, let me ask you, if you don't mind, what's your relationship with the doctor, the Dr. Okoawo?
I don't have any relationship of any sort.
You
Just like I don't have with patient Ilozue herself.
You don't know who the doctor is?
I know who the doctor is. He was my schoolmate in University of Benin.
Oh, okay. So he's your friend, basically.
Schoolmates, not friend. We are doctors. We are all doctors.
Okay, so I'm trying to understand how you got involved in all this. If it's not, I mean, if you don't have any relationship with him.
Yes, and this is how I got involved in it. He talked about the incidents in a meeting we had, in association meeting. Are you with me?
Yeah.
Okay. No, I don't mind if you record my discussion. It's okay by me.
Okay.
I'm not bothered about it. You can record my discussion. It's fine.
Okay. You know.
Yes, I have nothing to hide.
Okay.
So it's okay. Yeah, I'm not bothered about it. You can record it.
Okay.
Yes, sir.
I really don't have to record it, but it's okay.
No, when I'm saying that, in case you want to, because patients does that a lot, and I don't really care much about that. She does like recording things. But
so okay, so you have a personal relationship with patients too? Is that? I mean, I'm trying to understand. Yes. Like seriously.
Yes, I do. That's what I'm saying. I do.
Okay.
I do. I've actually seen patients, and I spoke with patients,
okay.
And I explained certain things to patients too. Just like I did with Ilozue Okoawo, and I read what is written there. The story is not exactly the way it is put on the net there.
So what is different? I mean, what's the difference? I mean, what do you think is the discrepancy there, right?
It's okay, but she has already reported the case to the Nigerian Police, to the health monitoring team, and the investigation is going on. Now, patient's mother, from what I gathered, had second stage endometrial cancer.
She had second stage.
Second stage cancer, endometrial cancer.
Was she? I mean, okay. I mean, was she receiving any kind of chemotherapy treatment for cancer?
No, that's the funny thing. Nobody knew. That's what I'm trying to explain to you.
Okay.
The woman was bleeding PV, and she's had fainting episodes before she actually saw the doctor. By the time she saw it, hello?
Yeah, I'm listening.
Yeah, what patients put in there that she was spotting blood. She wasn't spotting blood. She was bleeding heavily before she met the doctor.
Okay.
And they said she's been having fainting episodes.
Okay. Before
that particular appointment she had with the doctor. Are you with me?
Yeah.
Yes. So when she saw the doctor did what is called a hysterectomy, like you rightly know.
Is that the like all right, so I mean, doing a hysterectomy, someone who has uterine cancer, stage 2,
yes,
is that the treatment, the course of treatment usually, or is that like a special case?
No, you see, ideally the mainstay of management. Hello.
Yeah, I'm listening. You're clear. I can hear you.
The mainstay of management for endometrial carcinoma, it has different stages: 1, 2, 3, 4. One actually is removal of the uterus and the adjoining organs to prevent the spread. I think his intervention was actually meant to stop the bleeding so that the one will not die from bleeding, and do a histology to actually confirm that is his suspicion and remove the adjoining organs, then send her for maybe chemotherapy or radiotherapy. Are you with me?
Yeah, I'm listening. Okay, now, my thing is, because I'm trying to make sense of all this, right? I'm trying to balance.
Yes.
I'm trying to balance this thing and make sense of all this.
Yes.
Was there any, to your awareness? Because it seems like you have a lot of information about this case.
Yes, I do, from both of them.
All right. So my thing is, was there any tests done that any kind of diagnostic test done based on your knowledge about the woman's condition, or did the doctor just assume that she had endometrial cancer stage 2?
Okay, what I can do for you is this. I'm going to send you a histology report of the histology slides done on the uterus that showed they had endometrial carcinoma. I'm going to ask the doctor to send it to me so I can get it across to you.
All right, but you didn't answer my question. Was there any test, or was it just the doctor's assumption? Was there any test? Because I live in the USA. Yes. I live in the US.
I know.
And I know a doctor cannot just, see you and make the determination that you have a stage 1 or 2 or 3 or 4 or 5, whatever, cancer. Yeah.
The histology done after the surgery showed she had stage 2 carcinoma.
But was there any diagnostic test, MRI or ultrasound? You know what I mean? CAT scan, whatever. Was there anything done?
I do. Cancer is actually best. The diagnosis for such cancer is actually maybe an excisional biopsy. But again, you need to look at certain factors. One, her age will lead you towards the diagnosis. The woman was over 60, 65, and she was bleeding PV. She's had fainting episodes, and one common feature of people bleeding PV over that age could point towards a carcinoma of one of the pelvic organs.
All right, Dr. Michael Ossai. Honestly, I know you're a doctor and I'm not.
Well, I know you have an idea in medicine from the way you're talking.
Of course.
Maybe you do an MRI or CT scan.
Of course.
To show the staging of the. No. If that's your answer, your question, no.
Okay, so there wasn't any diagnostic test done, number 1. All right, so the doctor just used.
Surgery.
All right, so the doctor just used his expertise to diagnose someone of stage 2 cancer and advise for the uterus to be removed.
No, he did not make the diagnosis of stage 2. The stage 2 was made after the surgery when they sent the uterus that was removed for histology.
Oh, wow.
Do you understand what I'm saying?
Wow, okay. So wow. So the surgery, she was already, hysterectomy was already performed. And the woman had passed before
No, the woman had not passed. The woman passed. The specimen was sent same day or a day after the surgery, because when you do a surgery, you send your specimen for histology. Yeah, so the specimen was sent for histology, but the result came after she had packed, because here it takes a while before the result comes to histology, about 7 days to 10 days.
Wow.
After you send in your specimen. Are you with me?
Wow, yeah.
I haven't even seen the results, in all fairness. Are you with me?
Yeah.
I haven't seen the histology report, but from what I discussed with him, he said the results is a stage 2 endometrial carcinoma.
Wow.
Are you with me? Now, the take on this was that it may even have spread more than that, It may even have spread more than that. But my issue was this. Why is I only speaking? When the woman passed on, right now they're meant to do an autopsy, and anything could just be the cause of death. Anything could just be the cause of death.
Let me ask you, Dr. Ossai.
Go ahead, please.
You are a medical practitioner with maybe many years of experience. I really don't know. But what I would like to know is if your own mother. Okay, if your own mother went to see a medical practitioner, okay, and they advised her that she needed to remove her uterus, wouldn't you ask, if any kind of test was like a biopsy of the endometrium or whatever, wouldn't you have advised for biopsy to have been performed at least to make a concrete determination that, that actually it's cancer. You know what I mean? Like, would you allow your mother to be wheeled into an operating theater to have her uterus removed, and then take the uterus in for pathology tests later on? I mean, is that the way you would allow it to happen?
No, when you talk about biopsy, there are two types. You have what is called excisional biopsy and incisional biopsy. Excision means cut open and bring out. Incision is make an incision, go in and take a sample. Are you with me?
Yeah, I know.
Yeah, there are two different types of biopsy. For the question you asked, if it is me, I'm going to ask the same questions you just asked me. But you see, again, if one takes into cognizance her pre-morbid state before presentation, like they said, the fainting attack she's been having and the bleeding PV, the tendency of going into an anemic heart failure was there, actually. I am not in support of the fact that, like you said, maybe one would have gone ahead to do more diagnosis tests, like maybe an MRI or a CT scan.
At least, considering the fact that it was not a stage 4 or 5 or whatever, it was like a stage 2.
It's already stage 4.
Yeah.
Yes,
so it's not like, it wasn't like a life, it wasn't like, like right now, life-threatening, she's going to pass and die now. It's a stage 2, which means she could have gone for chemotherapy. She did not need to have her uterus removed, if I'm correct, right?
She could have gone for that. But if you put into cognizance the fact that she was bleeding PV.
Okay.
And she was having fainting attacks.
And there's nothing to stop the bleeding other than removal of the uterus.
Yeah, the uterus actually responds to drug management, actually. But again, at that stage, if it's me, are you with me? Hello? Yeah, maybe a non-Jehovah's Witness, maybe one would have cancelled that for blood at that time. Why would buy time to carry out the investigations? Are you with me?
Okay, but there are some medicine that can use to that they use to stop blood, like Premarin or things like that that can be used to at least stop the blood from do you understand what I'm saying? Like,
yeah, the uterus responds to drug at different stages. A pregnant uterus will respond to oxytocin, to ergometrin, to cytotec. This is a non-pregnant uterus.
Okay.
This is supposed to be a post-menopausal uterus.
All right. So, okay. I understand that we both agree.
Yes.
That it wasn't the right course of action. Like, maybe more extensive tests or diagnosis would have really saved the situation. Number 2, maybe counseling her for, to accept blood also would have helped, since according to you, she was bleeding PV, and
yes.
so those 2 things we agree on, right? It could have been done to prevent, what happened from happening, correct?
Yes.
Yeah. All right.
But again, my issue there was that because he's a Jehovah's Witness and the woman is a Jehovah's Witness, totally she will never even accept blood transfusion. Even the doctor would not, because that's their belief and their religion. Because like I know, I take on this that it's happened there, and I actually called patients and I sent my condolences to her, and I said maybe more time would have been needed to actually have cancelled 3 patients, based on her condition. But again, I'm not a doctor that saw the patients, so I wouldn't be able to say the things he saw at that time that warranted this.
I really do appreciate. I appreciate your honesty. I really do appreciate it. Your honesty.
No, in all fairness, one has to be honest in this.
Yeah.
I wouldn't, and that's why I actually said that patients should have been more honest also with her presentation that she gave to you.
Okay.
Because she did not put the woman's pre-morbid state. She didn't even say the woman had endometrial cancer. And even apart from that, in all fairness,
she said what she said in the what she said was there wasn't any concrete diagnosis, which it seems like was the case. It wasn't because you guys had to like remove the uterus and then take it to 7 days after she died to go and test and all that.
No,
So
no. The result came out like 7 days after, not 7 days after she died. You take it immediately after you do the surgery.
okay. So she didn't.
Okay.
Okay.
Yeah.
Okay.
Yes, the result takes a while, and that's you. After the surgery, you just send the specimen straight for histology.
Okay. All right.
Yes. What I was just trying to say in this was that, you know, the person involved, the Dr. Okoawo, the way he was represented in the story is not that. Patience is actually not a bad person from the little I know about her. Are you with me?
I'm listening.
You know? She's upright, but the doctor is actually being misrepresented, because I can tell you categorically, in all fairness, that guy has not done anything. Let me put it, after the death, he has not done anything like what patient is insinuating, that he's actually stalling investigation and direct. He has not done any of that. Rather, he met with me and spoke with me. Are you with me?
Yeah.
And asked that, Doctor, why don't you he spoke with me and explained the whole thing to me. And I called patients up. We both met and we talked. And we've been chatting after them. Are you with me? We've been chatting after them. You know? He's not made one call to say, okay, stop the investigation, don't release the case note, don't do that. No. I can tell you this. I don't stand to gain anything from this in any way. But I don't stand for the truth. He has not. Okay. He has not.
Okay.
This is just a
all right. I just have a few other questions, like just to gain a clearer understanding of what exactly is going on, right? And my second question is, I know as Jehovah's Witness, you know, they don't accept blood transfusion. And I know the doctor is also Jehovah's Witness, which was the main reason why patient's mom entrusted him with her life. You know what I mean? So are there not alternative to blood transfusion? There are some things that Jehovah's Witness.
Of course. You have iron dextran, you have plasma expander. She was actually on plasma expander. Please confirm that from patients.
Okay. All right. Okay.
She was.
Okay.
She was on plasma expander.
Okay. So was it like before? Was it before the surgery or after? Was she placed?
After the surgery, she was on plasma expander. That's what you do.
Okay, so you don't give it to the person like prior. You just give it to them after the surgery, right? The plasma.
On the person's, you do give. First of all, it's not that matters, because you must first of all understand the person's dynamics before you give. The only question I asked was, after the surgery, what was your post-op management? Was the patient on any plasma expander since you don't take blood? He said yes.
Okay, so like,
are you with me?
Yeah, this plasma expander, right? Okay. Here's my, because I'm trying to make sense of this too.
You can Google it.
Yeah, I'm trying to make sense of this too. And plasma expander, right? I would think somebody who is like Jehovah's Witness will be placed on plasma expander, like prior to surgery. Since like you said, this was not like a stage 5 cancer or anything, so there wasn't really like a do or die urgency. She could have been placed on plasma expander to make sure that she had enough blood in her. You understand? Before the surgery occurred. Am I correct?
No, you have an idea, but it takes 120 days.
Okay, so but what, I mean, couldn't that have I mean, couldn't she have waited 90 days?
90 days to 120. Yeah, there are certain things that is beyond my control and your control. That question should be left for God, because nobody knows what could have happened. I won't be able to answer that. I don't know you understand me. That if you leave her for like 90 days to 120.
I'm not a doctor, but I'm not a doctor, but if it was me in that situation, I think what I would have done would have been, number one, conduct proper test and diagnosis to make sure that whatever I'm diagnosing, I can back it up. I can corroborate scientifically what I think the problem is.
Both of us agree. Both of us have already already agreed
Yeah,
on this.
and then I would have put her on blood expander, all right, and found a way to at least prevent the bleeding temporarily while she gains, blood volume, right?
Mm.
While to boost her blood
Why
volume.
she gets volume, not necessarily blood. Why she gets,
Volume,
because you need
volume.
to have there's something they call a volume, in medicine.
Plasma volume.
Yeah,
I understand it.
which should be at a minimum, because what's happened to her then? She could have gone into what is called hemorrhagic shock. Hemorrhage. That is shock from loss of blood.
I understand what that means.
Eventually led to death.
Yeah.
So when you now give, so what you do for those kind of people is that you replace blood with blood for hemorrhagic shock. But in the absence of blood, in the interim, we have things that we can use, infusions, and maybe the plasma expander to get to that volume before you now say, okay, let's get blood or so.
Okay, but if they had come to you and you were the physician, I mean, I'm sure that would have been what you would have recommended. Like, let's try to put her on this thing to boost her plasma volume. You understand?
Yes.
And then maybe temporarily stop the blood for like 90 to 120 days, and then do proper tests within that. If she dies within that period, it's understandable. But to just assume that this is what she has and then do the surgery and then this woman dies, to me, I think is shows a level of carelessness, doctor. Let's be honest now, I beg. You know what I mean?
Both of us have been honest since this discussion started.
Yes.
And we are still maintaining that honesty.
Yes.
What you have said, you have not gone too far away from the truth.
Okay. All right. Okay,
yes,
so
you have not gone too far away.
And I appreciate,
honestly,
I do appreciate your honesty. Another allegation, all right, because that's what it is now, because Dr. Okoawo is, innocent until proven guilty in a court of law, which has not happened yet. So as far as I'm concerned, he's not guilty of anything. But patients accused him of of not being a gynecologist, to your knowledge. Is he a gynecologist, to your knowledge?
He is, I don't know how to answer that. He is not, but we all do basic obstetrics and gynecology in medical school.
Doctor.
But he is not.
Doctor.
Yes.
I would love it.
Listen, let me say something. If you Google Innocent Okoawo, before this, Innocent is an anesthetist.
By profession, right? Yes,
he's a medical doctor, but specialist qualification.
So
the other qualifications added. He is also certified by the World Laparoscopic Surgeons.
What is laparoscopy? What does that mean?
That is what I was trying to tell you. Laparoscopy is a kind of surgery you do with a pinhole. You understand what I'm saying?
I don't think I understand what a laparoscopy is. Yes.
Yeah. Yes, he is. And they can even do a myomectomy, that's removal of fibroid via laparoscopy.
Exactly, I know that. I know that.
In fact, even if you look at the picture you pasted on there, you will see him, and behind him you see where the roots. If that picture is in front of you there, read what is written behind. When you wrote Phoney and Guide, you see the picture there. You see him when he was being awarded the degree. Dr.
Ossai, as an anesthesiologist, as somebody who has some kind of induction or whatever certification to perform laparoscopy, is not the same thing as cutting somebody and actually going in to remove a uterus. I don't know if you understand what I mean. I think I'm knowledgeable enough. Okay, I'm knowledgeable enough to understand, that there's obviously medical malpractice that happened in this case. A lot of things that went wrong. Do you understand?
You are not wrong on face.
Okay.
Yes, I'm not. Like I said initially, that I'm not holding brief. I need you to get me.
All right.
But what I'm saying is, there is still some form of misrepresentation. Like, I'm letting patients understand that this same person did not and has not in any way called that the case should be stalled. She made an accusation that money may have changed hands, and I told her that is indicted.
No, it's actually is not. It's actually her opinion. I can say anything I want, without mentioning names. She did not mention anybody's name, so it's not indicting.
No, she did.
She did not. No, she did not mention names.
She did. She wrote the acting secretary of HEFAMAA, Dr. Something. She wrote the name there.
Okay, but she said she can only assume that maybe money could have exchanged hands and Nigerian corruption and blah blah blah. Yeah. Okay.
Yes.
All right.
But I'm telling you, not fairness to you and me.
Money did not.
I stand on my faith, and I can tell you that money did not change hands. Okay. I don't know that you believe it or not, but I am telling you.
Okay, I believe you.
Money did not
I believe you. I believe you honestly. I believe you. Okay, now another question, right? The withdrawal of the 250,000 naira that patient's mom had paid the check and had a standing order at the bank that any withdrawal above 50,000 should require the bank to call her for verification on the phone first before making that payment. How did Dr. Okoawo now, how did he manage that? What does that tell you?
I'm going to explain that to you also because I've asked all these questions. Now, look at the scenario. Are you with me?
I'm here.
This is what happened because I asked him. The woman wrote the check and the check was given to him on a Saturday. Are you with me?
Yeah.
He has an account department. He did not even see the check. He has an account department and he said confirm from patients. The check was presented to his account department. It is that department that goes to pay in checks or does recording of many money received. Now, the first thing the account department did on the Monday morning was to go and present the check at the bank. Are you with me?
Yeah.
Patient's mother passed on Tuesday. That was all he did. He didn't even know that the check was taken by the account to his bank, Zenith Bank.
But Dr. Ossai, make I ask you, I beg. If you have a standing order, let's be honest though. Let's be honest. If you have a standing order at your bank, if I have a standing order at my bank and I'm like, any payment above $2,000, please call me for. There's no way. There's no way. There is no way. It's a huge violation right there. Okay?
Let me explain something to you. There's something you and me will not be able to say because there are things we don't know.
Understand?
But I tell you, no, listen to me. He actually said patients can go and see Diamond Bank and find out. I spoke with him today. He said, let her go.
How will she find out? Doctor, let's be honest though. We want to make heaven. Doctor, we want to make heaven. You and I. Let me tell you, let me tell you, it's always good let's stand on the truth when we see the truth. And I like the fact that you've been very truthful and honest about yes.
I still am on this.
You and I know, You and I know something went wrong there. Okay? Something went wrong there. And you and I know the Nigerian system, how that could have happened. Something went wrong there. Whether an account manager went there or the doctor himself went there, somebody in the bank was working in cahoots with whoever presented that check to have that money cash without confirming or calling the deceased or the person who wrote the check who had a standing order. Do you understand where I'm going with this?
Let's put it this way. I've listened to you, and I also listened. Patients had made this known to me also, but now something transpired. When that check was in when patient's mother died, patients asked for the check for the money. He now told patients that look, since the check has not been confirmed, it will return back. It will return back, but my account department had actually gone to pay it in, but they will return the check back since your mom is not alive to confirm the check. And once they do that, I'll get the check across to you. Are you with me?
Yeah.
There's a discussion on that if you don't mind, I can actually add them to further discussion and I'll forward it to you. That was what he told patients that, if the check is actually pre-confirmed, that means they will not honor the check. They will return it and I'll get the check across to you. Are you with me? Yeah. Then, coincidentally, the check was honored, and he called me, he said, Ossai, that check was honored, and I received an alert that it actually cleared.
And he could have asked for that money to be returned. He did not have to take it.
defamation and a misnomer. He did not, even till now, even then. If you follow this, as I said, I'm not holding brief for him, but we don't want to make him like rightly say. And in all fairness, one has to be truthful. You see, no matter the situations we face, I said temptations will come, but the truth is, no matter life has traveled, the truth will catch up with it someday.
Yes.
That's my belief. And I am telling you that in all fairness, the only person I have is God, my witness. That guy had no intention for that. When the thing came, he called and told me, said, look, see, this thing has cleared, and I don't need this money. He told me, until date, he still stands on it.
Well, let me tell you where he made the mistake, which I think was what really upsets patients, was when he went ahead to clear that money, and he did not ask for that money to be returned. That was, I think that was the main thing that really got her, upset, and I'm thinking all this would have been, could have been avoided if he had simply said, oh, okay, just part their conversation or agreement that, okay, this check cleared, though, we're not expecting it to clear, but it cleared, but they are returning it back, and returning it right away back to the family, not specifically to patient, because patient is not really interested in the money, because I've spoken to her to determine, I've spoken to her to determine where her interest lies in this matter. And I can tell you, it's not the money for her. Do you understand? It's not the money.
I know. See, when patient gave him her account number, are you with me?
Yeah.
So you pay the money to this account. That's when he now told patient that the check has already been presented. But since you said the check had to be pre-confirmed and your mother is late, that means the check would be returned. Are you with me?
Yeah.
Now, events that happen within the next few days, patient now put that the doctor should not communicate. He showed me discussions where patient was just writing, and patient said, you don't have any right to respond to any of this. His own was like, okay, now this thing has cleared. This guy said I should not respond.
I really feel sorry for this doctor, because sometimes sometimes we go do something, you won't know that what you do will come and bite you in the rear. You understand? Even your good heart, because that type of surgery is more than 250 now. Do you understand?
It's more than 250.
Yes. Yes.
That surgery is almost $1 million. The guy just wanted to help. See, that's my dear, you actually get this.
I understand it.
The guy just wanted to help.
It's unfortunate.
250. Okay, make I open up to you. When that thing cleared there, I told him, give me the 250. Give it to me. I'm going to discuss with the members of the family. And that is why you see I spoke with Eddie Lawani. I'm Eddie's personal physician. I'm a Mrs. Mother's physician. And I said, okay, I said, give me. Now, he now said, but the girl is saying I shouldn't talk to her. That was why I went to speak with patients. The cash, what is with me? As I'm talking to you, it is still with me now.
So, okay, so let me tell you, me, I want a peaceful resolution. And honestly, I appreciate all your own effort. You carry this thing for head like saying now you get the case. So, do you understand? I applaud you. I applaud you, and I know it shows the kind of person you are, that you are a ride or die kind of friend. Do you understand? You are a good friend that will stand.
I am the only friend. Let me tell you the truth. This guy will not stand at my back if I'm the person involved in this case.
Oh, wow. Really?
Do you know I'm standing? Yes.
This life.
What I'm trying to tell you that what I'm doing, I'm not doing it for any gains.
Yeah, I know. Because you see, you know what? You have, what will I call it now? You can see the whole picture. You can see how this is going to end. Yes. You can see, so this is not going to end well for him in any way. It might even end up having him go to jail for likely or possible murder, medical malpractice, stripping of his medical qualification, multiple litigation by people that have died, in his, hands, that not knowing that he's not a qualified, qualified gynecologist. Yes. You see the entire picture. All right. Yes. This is gonna cost him everything he spent his life working for, just because of one One incident. And I don't like where one incident will now wipe away the good work or the good deed that somebody has done. Do you understand? All right.
If you read write-ups about it, where he does things free for people, in newspapers, in dailies, people who don't have money to pay for their bills, 400, 500, he writes it off. I've seen it in national dailies. I've seen no fairness.
Wow.
I'm not holding back, but I have seen these things.
No, wow. It's just unfortunate,
Man, it has to be fortunate now.
It's very unfortunate.
For me to ask Eddie to speak with you, you should know. For me to call Ameze. Even Lola in London. You know Lola?
Which Lola?
Lola now, Elijah's daughter. I don't know if you know Lola.
What's her last name?
Well, you know Lola. Who knows last name? Lola has about 5 kids.
What's her last name? Do you know her? Do you know her?
Lola Chamin or something like that.
I don't know. I don't think I know her. Is she my friend on Facebook?
You don't know?
Is she my friend on Facebook?
She's your friend on Facebook now.
Let me tell you, I have about 5,000 friends. I don't know all of them. I have almost 20,000 followers. I don't know all of them. I don't know majority. I don't.
Even when I asked Ameze to speak with you, Ameze was like, "Ossai, Marion, you know, how close are you to her?"
I sure say Ameze go dey fear myself. She feel they fear me, oh, you understand? I maybe because she feel they fear me. Like, what? That woman is too hot. You can't go near her. You know what I mean? I don't know. Just saying.
you know, she just lost her mom.
Oh, I didn't know that.
She just lost her mom. I know that's why. Eddie had to call it from the club. Eddie had to do it for me. Eddie will know I will not stain my hands. Even the wife. You know this wife, Tonya.
And not personally. Not personally.
Tonya has said, Dr. Ossai, for you, we will do anything in this case. Not for the doctor. Not for him, but Ossai, for you, we will do.
Let me tell you.
Even if it means me lying down. Eddie has said it. Even if it means me lying down, Ossai, for you, we will go and lie down.
Okay. Eddie knows me. Eddie knows me. I don't know what he told. He doesn't know me like know me. But we've spoken on the phone a few times, and he's somebody that I respect in the industry, and I think he equally respects me too. You understand? And for him to have reached, I was like, Mario, you know, if I reach out to you like this, you know, this thing is serious.
Yes, thank you.
That's what he said. Yeah, he said this thing is serious. You know, you know, when I spoke to him on the phone. And he was, you know, telling me, I said, I don't know what to be your own for inside this matter. I don't understand it. And I said, this thing already, I don't put them out there. And trust me, it's going to go. Blogs have started posting it. Or that I will send you another link today. Blogs will pick it up. They will post it. It will start going. And let me tell you another thing. Patience has radio interviews scheduled. Do you understand? Starting this coming week, where she go maybe Wazobia Radio, go sit down there and talk about Dr. Okoawo and this thing. I don't know if you understand where I'm going with this. It's not gonna end well. It's not gonna end well. It's not gonna end well.
Mario, you need to call patience. You need to call patience. You need to do that for me. You need to call patience.
And tell her what now?
You need to. I don't know. I can't put words in your mouth. But just be led with whatever comes out of your mouth.
This is Pillow Talk.
With Marion the Man.
Fabuloso. True stories.